many people love the results they see from aesthetic injectables such as Botox and facial fillers, but many can also be leery when it comes to putting a needle into their face. So Dr. Ann-Therese Stubbs of Ann-Therese Aesthetic Medicine here with a new way to get these results with less discomfort. So we like to hear this. Thanks for being here, Dr. Ann.
Thanks for having me.
All right, first of all, is that fear of the multiple needle injections kind of something that people have trouble getting past?
It is, and there's a lot of people who just fear needles in general, and with facial fillers specifically, there's an incidence of a little more bruising because you're putting a needle through the skin multiple times and maybe just volumizing a certain area of the face. So there's a chance of bruising and some discomfort, and some people shy away from that, especially if they've got a special event that weekend or they're a week out of a wedding or something. They might hold off on the facial fillers. So the cannula is a new way to deliver the facial fillers without a needle.
Right, and this is not a new medicine, a new injectable. This is a new, as you said, delivery system. So tell us how it works.
Exactly. We use the same fillers that we've always been using, and we can choose different fillers for different areas, but we can deliver those into the skin with a cannula. And you're seeing a little video here. I'm going to volumize the middle of this gal's face. She has a little hollowness right under her eyes and kind of a little crease there that she wanted some volume in. So just with, we put a tiny bit of topical numbing cream on the face, and that's why she looks a little bit shiny. And then we make one tiny little needle hole in that area that's numb. You can see there's no flinching. She didn't even really realize that that was happening. And then what you're seeing right now is a long cannula. There's no sharp edge to it. It's a very small little metal tube, and the filler is delivered through that. So we can kind of push that into the skin, right under the skin, and it's largely painless. You're seeing we're blowing some cold air on her face too. That does two things. It decreases any blood flow to the area so that we, again, decrease any bruising. And people usually walk out after this treatment with the volumized result of filler, but not a bruise on their face.
And does this make it easier to get the injectable where you want it? Because as you mentioned, some people need different injectables and fillers depending on the area of the face they're talking about.
Exactly, and it's a safer delivery system too. Because the cannula has no sharp edge, it doesn't tend to shear any blood vessels or, basically cause any bruising, and there's less of a chance of getting any of that filler migrating where you don't want it. So it's a more exact delivery system, and it's kind of the new hot thing in fillers right now. So physicians and nurses that deliver fillers are learning to use the cannula. We've used them for about 4 years now, and I would say that probably 90% of my patients prefer that, just because they know it's not going to hurt as much. They know they're going to walk out without a bruise on them. It might take a little bit longer in the office, but they're all willing to do that just to get out without a bruise.
Absolutely.
And a little less discomfort.
And so where on the face can it be used? We're watching at that one area in the cheek. Are there other areas we can use it?
Yes. In fact, I use it all over the face. We use it in the mid cheek, as we just saw, and then you can see this video here. I'm volumizing the area of her chin. The downward turn to the mouth is an area that a lot of women don't like, so we can fill that area just by kind of putting a little bit of filler in that whole kind of crease that goes downward from the mouth to the chin. We use it too in the temples. We use it in the cheekbones, and we even use it in the lip area, right above the lip. When you get those little vertical lines that nobody likes, people call them smokers' lines, but more people get them than smokers. Anytime you get those little vertical lines, we can fill those with the cannula too, and eliminate any bruising that might result.
And you mentioned too the results are sometimes smoother for people,
Exactly.
So they probably love that about this.
Exactly, and some other people are fearful of fillers. They don't want it to look unnatural or lumpy at all, and this is a nice even delivery system through, as I mentioned, nothing sharp on the end of it, and so it tends to give us a more natural result too.
All right, today's deal for these, Dr. Ann, a little BOGO.
That's right. Fillers are, usually purchased in one syringe, and usually they range anywhere from $600 to $900 in this town for 1 cc, and we're doing a buy one and get the second one free.
Amazing. All it takes to get started, of course, is a phone call to Dr. Ann. Thanks for being here.
Thanks for having me.